Hi, my name is Brad Agrawal. I'm a partner in Oasis Dental Group and I'm the principal dentist at Oasis Dental Churn Park. For me, it's always been about creating patient experiences that are unparalleled. I know that dentistry is not fun for the average person. No one wakes up in the morning and goes, hey, I just can't wait to go to the dentist. So for me, it was born from this desire to create something amazing, something that was different, something that challenged people's perceptions of how dentistry is meant to feel, how it's meant to sound, how it's meant to smell. And for me, it was finding a space and creating a place where you could do excellent dentistry would flourish, and it was representative of the work that we're doing in our patients' mouths. When you walk into one of our dental studios, the goal for us was to make sure it didn't feel like walking into a dental practice. All of those preconceived feelings, those emotions that you may have that were attached to going to the dentist as a child, or even say any other sort of dental practice that you may have visited, it's about taking those completely away from you and redefining that whole experience. How do we deal with the discerning patient? For us at Oasis Dental, it came back to making sure that all of our patients felt like their voices were being heard. And not just patients that were highly discerning, but every single patient that walked into our practices. It goes back to us just listening to our patients. We spend a lot of time at that first consultation ensuring that we're all on the same page. And for me, every single patient is a patient that I want to see for the rest of their lives. From there, it's about figuring out what it is that drives and motivates our patients. And if it's something that's really particular, something that's really specific, we make sure that we're tailoring our treatment plans, tailoring our delivery of our treatments in a way that's going to be most comfortable and in a way that that patient's going to be able to receive the result that they're after. So we work with all different types of private health insurance companies. So if you do have private health cover with extras, we have high caps where you can claim on the day. So for the majority of your procedures, you get your rebate on the day, only having to pay then the gap on those procedures. For more complex dentistry, we completely understand that this can be quite expensive and sometimes overwhelming and daunting. And for that reason, we offer lots of different types of payment plans and different types of payment options, and that can then sort of break up the cost over a longer period of time for certain procedures as well. Patient education is like paramount to everything that we do. For us, it's the patient understanding as much about the basics of dentistry as we do as dentists. What would we want in our mouths, and helping our patients sort of understand that as well. For me, it starts with taking photographs of the patient's mouth and ensuring that we go for a tour of the mouth, essentially tooth by tooth, determining where things are at, where things are working, where things maybe not be working so well, and figuring out a way to then come up with a treatment solution that works best for the patients. I truly believe that our team feels respected, they feel like they're there to make a change, and as a result of that, our patients are the ones who get to benefit from that. Our patients see and are dealing with people who genuinely want to be in that space and genuinely believe and know that they're making a difference, and I think that's what's exciting about Oasis Dental. It's a group of clinicians, a group of people who genuinely are there to make dentistry better for all the patients that they come in contact with. I have a really interesting relationship when it comes to the term cosmetic and cosmetic dentistry. I think when we talk about cosmetics, we're really talking about something that is so driven by trends, fashions, fads. For me, it's almost like a non-medical term. When we talk about cosmetics, we're talking about things like jewelry, putting on new earrings, buying a new handbag, buying a new tie or a suit. That's where it becomes concerning, when treatment's being done to augment things that may have benefited from, no treatment for starters, or maybe treatments that could have been less aggressive. And I think that's where that sort of love-hate relationship and that bittersweet feeling I get from, the term cosmetic dentistry. Too often I see these days people seeking and treatment being delivered that I don't think is necessarily in the best interest of the patient's long-term health. It seems like me being so pedantic when it comes to terminology, but when we talk about aesthetics, we're talking about things that are age appropriate, things that are respectful to health, to biology, things that are going to look good now, things that are going to look good in 10, 15, 20, 30 years, and not just driven by current beauty averages and norms. So for me, that's what I'm really passionate about, is helping educate my patients, the general public, other clinicians when it comes to my teaching commitments, and having conversations that are underpinned by that philosophy of making sure that we are always thinking about the long-term implications, the long-term health implications, and just making sure that we're doing treatment that is going to obviously look good and help our patients feel better and more confident, but doing it in a way that's far more respectful of their health, biology, and their long-term health outcomes. And the exciting thing about modern dentistry, when it's done really well, is there are so many techniques that we have when combined together, and that's where the challenge is putting everything together. We can deliver results that we've never been able to do as predictably as we have now, and it takes a lot of planning, a lot of education, alignment, whitening, bleaching, veneers, but doing it in a way where we're combining everything together to figure out the best possible option for our patient.